Alterations in the respiratory system encompass a wide array of changes affecting both the structure and functionality of the respiratory organs. The respiratory system is fundamentally divided into two main zones, the conducting zone and the respiratory zone. The conducting zone comprises the respiratory passages tasked with transporting air to the site of gas exchange. This zone serves the additional roles of filtering, humidifying, and warming the inspired air. The respiratory zone, on the other hand, is the primary site of gas exchange and includes critical structures such as the respiratory bronchioles, alveolar ducts, and alveolar sacs. The process of respiration fulfills a pivotal role in gas exchange by transferring oxygen from the atmosphere into the bloodstream while simultaneously facilitating the elimination of carbon dioxide from the body. This complex mechanism is under the regulation of the nervous system, which orchestrates respiratory muscle movements, modulating the breathing rate to meet the varying demands of bodily activity levels. Nasopharyngeal airways can encounter impairments due to neural control issues of the tongue and pharyngeal muscles, often seen in comatose states or certain neurological diseases, allowing the tongue to fall back and obstruct the airway. Additional obstructions may arise from pharyngeal structure swelling caused by injuries, infections, or serious allergic reactions, or the presence of foreign bodies. The pleura, a thin, transparent serous membrane with dual layers, lines the thoracic cavity and encases the lungs. The outer parietal layer aligns with the chest wall, while the inner visceral layer adheres to the lung surface. These pleural layers are separated by a thin layer of serous fluid, maintaining a negative pressure in the pleural space relative to alveolar pressure, thereby preventing lung collapse. Ventilation, the mechanical movement of air in and out of the lungs, relies on open airways and respiratory pressures, which are influenced by changes in chest cage dimensions due to respiratory muscle activities. Lung inflation and deflation are dictated by respiratory pressures, lung compliance, and airway resistance. Gas flow adheres to pressure gradients, moving from high to low pressure areas. A decrease in thoracic pressure relative to atmospheric pressure facilitates air entry into the thorax. Lung compliance denotes the ease of lung inflation, presented as the change in volume relative to respiratory pressure shifts. Airway resistance, impacted by lung volumes, is lower during inspiration due to elastic fibers connecting airways to surrounding tissues, allowing expansion during lung inflation and narrowing during deflation. Lung volumes, or air exchange quantities, are classified into components: tidal volume, TV, inspiratory reserve volume, IRV, and expiratory reserve volume, ERV. Tidal volume, typically around 500 milliliters, reflects the air volume moving in and out of the lungs during a regular breath. Inspiratory reserve volume marks the maximum additional air intake beyond normal inspiration, whereas expiratory reserve volume indicates extra air exhaled beyond normal expiration. The efficiency and workload of breathing are defined by the minute volume, the total air exchanged per minute, calculated by multiplying tidal volume with respiratory rate. Under normal activity, this figure approximates 6,000 milliliters through a tidal volume of 500 milliliters and a respiratory rate of 12 breaths per minute. Respiratory function alterations cover infections like influenza, pneumonias, and tuberculosis, as well as neoplasia, lung cancer, and pediatric respiratory disorders encompassing lung development issues, respiratory distress syndrome, and bronchopulmonary dysplasia. Disorders are further classified into interstitial or restrictive lung diseases, pulmonary vascular disorders such as pulmonary embolism and hypertension, lung inflation disorders like pleuritis, pleural effusion, pneumothorax, atelectasis, and obstructive airway disorders involving conditions like bronchial asthma, COPD, emphysema, chronic bronchitis, and cystic fibrosis. Respiratory failure represents a critical condition wherein the lungs fail in oxygenating blood or eliminating carbon dioxide efficiently, often emerging from impaired ventilation or disrupted pulmonary blood flow, with contributing factors like respiratory muscle weakness and airway obstructions. The conditions leading to respiratory failure also include hypoxia and hypoxemia, indicating acute or chronic reductions in oxygenation due to inadequate ventilation, diffusion issues, shunt phenomena, or ventilation perfusion mismatches. Cyanosis, characterized by a bluish skin and mucous membrane discoloration, occurs from elevated levels of reduced or deoxygenated hemoglobin in small vessels.